Hello, and welcome to Connecting Prevention to the People, Voter Attitudes, Prevention Messaging, and Where the Prevention Fund Stands. If you experience technical difficulties during this WebEx session, please dial 1-866-229-3239 for assistance. You might want to write that number down for future reference. The audio portion of the web forum can be heard through your computer speakers or a headset plugged into your computer. If at any time you are having technical difficulties regarding audio, please send a question in the Q&A panel, and the host will provide the teleconference information to you. Once the web forum ends today, a survey evaluation will open in a new window. Please take a moment to complete the evaluation as we need your feedback to improve our web forums. We are encouraging you to ask questions throughout today's presentation. To do so, simply click the question mark icon, type your question in, and hit send. Please send your question to all panelists. We will be addressing questions both throughout and at the end of the presentation. We will be using the polling feature to get your feedback during the event. The first poll is almost on screen. There we go. Please select your answer from the available choices and click the submit button. So that poll is, are you attending this web forum individually, in a group of 2 to 5 people, in a group of 6 to 10 people, in a group of more than 10 people? It is my pleasure to introduce our moderator for the day, Matthew Marsom. As Vice President for Public Health Policy and Advocacy for the Public Health Institute, Matthew is responsible for designing and implementing PHI strategy for monitoring and influencing public policy, legislation, and regulations affecting PHI projects and public health policy relevant to PHI interests. Matthew, please go ahead.
Thank you, Star, and thank you, everybody, and welcome to this Dialogue for Health web forum. I'm thrilled that so many people could join us today for this critical topic. The title of the forum, Connecting Prevention to the People, Voter Attitudes, Prevention Messaging, and Where the Prevention Fund Stands. I'm really pleased that we have a really wonderful panel that can be here today to share their insights and their perspective, and I want to acknowledge, and I'll go through who each of them are today, Rich Hamburg, Laura Siegel, Ann Whidden, and Rob Waters. And Rich is a familiar face to Dialogue for Health. He's the Deputy Director at Trust for America's Health, and he oversees public policy initiatives, advocacy campaigns, and internal operations, and has more than 25 years' experience as a leading health policy advocate. And will be talking to us about what's the current status of the Prevention Fund and the Community Transformation Grant Program, and what the current political landscape looks like for the fund. Laura Siegel is the Director of Public Affairs for Trust for America's Health, and I believe, Laura, this is your first time speaking on Dialogue for Health, so welcome. And Laura oversees public affairs, communications, policy research for TIFA, and she brings more than 15 years of strategic communications experience. Prior to joining TIFA, Laura was directed corporate communications for health and technology companies and worked as well for the Clinton-Gore campaigns, the White House, and the administration from 92 to 2000 in a variety of communications and political capacities. So, Laura, welcome. We look forward to hearing from you today. Ann Whidden with Public Health Institute is our Director of Communications, and she leads our communication strategy, messaging, and framing development and media outreach efforts. She has 20 years' experience as a health and communications professional, working with progressive corporate and nonprofit clients to create compelling strategies that amplify best practice, capture media attention, and inspire action. And thank you for joining us and for being here today. And last but not least, Rob Waters. I also think that this is Rob's first time on Dialogue for Health. He's the Chief Communications Officer at Prevention Institute and has worked in journalism for more than 30 years with a focus on health, science, mental health, health policy, and child and family issues, and has covered health, science, and biotechnology for Bloomberg News. He was staff writer at Health Magazine, senior editor at WebMD, and editor of the Tenderloin Times, which is a full-language monthly newspaper in San Francisco's inner-city Tenderloin neighborhood. He has extensive writing experience for Mother Jones, Parenting, San Francisco Magazine, Reader's Digest, Family Circle, and others, and was also awarded fellowships from the University of Maryland, fellowships in Child and Family Policy, and the Rosalind Carter Fellowships for Mental Health Journalism. So thank you, Rob, for joining us today as well. I look forward to your perspective that you're going to share. And so that's our panel, and we do have a really a great discussion and scheduled for today. I want to thank our sponsors, though, particularly as well as Public Health Institute, Prevention Institute, and Trust for America's Health for their support in ensuring we can put this panel and web forum together today. Here's some background on those organizations. We'll share this again later, and you'll be able to download all of the slides and information, including also the audio. You'll be able to download the audio if you miss anything and want to go back. So just a note about that. The web forum objectives today, we're going to hear an update on the Prevention Fund, as I mentioned. And I'm sure we're all aware, or we should be, how directly under threat the Prevention Fund continues to be, in this post-sequestration environment, and as funding is being shifted by the administration for other priorities, it seems that the Prevention Fund continues to be used as a piggy bank and a cash fund for other activities. And we'll be hearing about what the latest is and what we can do to prevent that and also to protect the Prevention Fund. And importantly, we're going to hear about the messaging and also the perception of prevention and community prevention and public health, both at a national level and also in using California as an example, how voters feel about the prevention and public health. And so we'll be sharing and discussing findings from some focus groups and survey research conducted by TIFA and Robert Wood Johnson Foundation, as well as hearing about a field poll conducted by Public Health Institute as well in California. And then based on all of that, we'll be talking about how you can craft prevention messaging and help to support prevention and reach out to elected officials. So as well as that, of course, we'll have an opportunity for Q&A and discussion, and I want to remind you all that you can use the Q&A feature. Oops, I'm sorry, I'm going all around. I want to bring it up on my screen. Here we go. Use the Q&A feature to send in your comments and questions for the panel. It's on the right-hand side of your screen, so do please send us your comments, send us your questions, and we'll be sure to respond to those today throughout the panel. So with that, I'm actually now going to hand over to Rich Hamburg, who will be our next speaker to give us an update on the latest with the fund. Rich, over to you.
Thanks, Matthew. Always glad to be on the call. I'm looking forward to all the discussions on messaging, because that really is critically important. My role today is just give a little update on where things stand on the fund and federal funding for wellness, prevention, public health in general. It remains challenging, to say the least. So, title of the slide, never said it would be easy. Understatement. It's been rather difficult several years to multitask between implementation of all of the public health provisions in the Affordable Care Act, plus the coverage provisions, and at the same time fighting this ongoing political battle. Somewhat, not totally unexpected, but somewhat unexpected at the length and depth of the resolve to try to cut these programs. As most of you probably know, we've had 37 efforts in the House of Representatives alone, 38th probably coming next week, to eviscerate the Affordable Care Act and the Prevention Fund. So some of those efforts were to defund or to remove the provisions of, void the provisions of the full act, some parts of it, including the Prevention Fund. Luckily, from a batting average standpoint, always about baseball with me, we're batting somewhere in the 900 area, but unfortunately, the one cut that was taken was a $6.25 billion cut to finance so-called DocFix last year. Seems like a long time ago. It was January 2012. And so that is, I'll show you a chart in a minute, but that's a cut over a series of years. 332, so we're doing, two things are going on here. One is preserving the long-term health of the fund into the future, and the other is, looking to ensure that funds are not diverted in any particular year. So the hit that we've taken this year is short term. It's $332 million was diverted from the fiscal year 2013 prevention fund for implementation of the insurance exchanges, plus a $51 million cut from sequestration. And yes, this mandatory fund was subject to sequestration. Unfortunately, Congress, for a variety of political reasons, didn't appropriate funds in 2013 for implementation of the Affordable Care Act, so the administration was forced to find money elsewhere. And as large as the $332 million seems, that was just a small piece of well over $1 billion that they needed for implementation of the exchanges. So, we're looking at in 1 year a 38, almost 38.5%, I think, cut in money available for traditional prevention public health causes. So that's $615 million of the $1 billion this year for fiscal year 13 is available for that. The macro issues, looking at the overall discretionary budget, the House Labor, Health and Human Services allocation, so that's the money that goes to the subcommittee with oversight for labor, health, human services, and education, a proposed 18.6% cut. I mean, that's a 1-year cut. It's pretty incredible, and that's a cut that of a magnitude that I've never seen in almost 30 years of doing this. I think overall we're also facing continued pushback on policy change, whatever we're going to call it, strategies, policy change, advocacy, the idea that that we can achieve some significant progress in promoting healthy living, healthy eating, public health in general, that there are those policymakers who seem threatened by the successes of such policy change. And I usually don't go into detail on some of these lobbying restrictions, but this time I do want to remind everyone that there are more severe lobbying restrictions in place. 2 federal grantees. There's oversight. There's at one point or another there are letters running from the Hill to HHS, Inspector General to HHS, from external groups to grantees, all if nothing else trying to scare the bejesus out of some of the grantees. So that's just something that you should be aware of. But the good news is that, well, first more bad news. The drowning in red ink slide here, don't have to go into detail, but you'll see that every which way we turn, in almost every circumstance, there are cuts or proposed cuts, potential cuts. The idea that we could see funding to the Department of Health and Human Services 1/4, 26% cut, only over a 4-year time frame is truly mind-boggling. So, a couple of graphics here. I think some of you have seen this chart before. The green is the statutory dollars for the prevention fund. The blue is what remained after the so-called doc fix. So, again, the positive is that the growth will slow, but it will still reach $2 billion a year by 2022 and continue in that fashion unless Congress and the administration does otherwise between now and then. In the short term in 2013, you'll see the stripes there, the blue stripes of the money that went to the exchanges, the $51 million in the sequestration cut, leaving approximately $615 million for this year. And it has an impact on the kinds of programs that we're interested in. Overall CDC budget authority, adding in even adding in the prevention fund, you see we're on a downward spiral that's leading us to levels that we haven't seen since early in the 2000s. And we didn't add a chart or didn't add a bar for the House of Representatives recommended figure, but that I think throws us back probably into the 1990s somewhere. So we're dealing with major cuts year in and year out, and you can see just how deep the cuts would be without the prevention fund. And looking specifically at chronic disease programs, the first couple of years, the Prevention Fund did what it was meant to do, which was to make up for years of chronic underfunding. Basically, some decreases in overall flat funding in chronic disease since early in this decade or in the past decade, and now you see what part of total chronic disease funding is from the Prevention Fund. If you look at the President's proposed budget for 2014, you remove the Prevention Fund and go left, you'll see that that we would have to go way left of the year 2013 to reach levels for the CDC that are being recommended this year. I think we have to go back into the late 1990s. So, what can we do? Bullet 1 is going to be taken care of with the rest of the presentations. The public does believe in prevention. It's worth the investment, whether it saves money or doesn't save money. We've built support collectively. Thank everyone on the line and many of your colleagues. This number has grown and grown over the last couple of years. Now I think we're over 790 national, state, local organizations supporting the Prevention Fund. But here's the key. We need to show members of Congress where the money's going. We need to build relationships between the grantees, and those benefiting from the grants with elected officials. That is absolutely allowed. I don't care what restrictions that people put into place, that is absolutely allowed. You're a grantee, you're an organization that's benefiting, an organization that's interested in what's happening with these grants, including the community transformation grants. You can communicate with your elected officials. You need to create relationships. You need to develop and expand your own list of state and local organizational champions for these programs. We need visibility. For those of you who get our Public Health, Wellness, and Prevention Digest, you'll see almost every day we highlight stories of success. So I think that the media is beginning to cover these stories. Overwhelming percentage of them is positive coverage. We need to continue to do that. And then we also need to engage those other players, so to speak, the leadership committees, the sub-grantees. Most of the community transformation grants are sub-granted, and so there are many who are benefiting from this. Champion development, something you've heard us talk about in the past. These aren't hard and fast names here, but these are key names that we've rallied around. I'm trying to identify a couple of handfuls of members of the U.S. Senate in particular who will champion the Prevention Fund, who will champion all the programs under it. And I think that's critically important. Many of us have turned to or have relied on Senator Tom Harkin in the past, but over the last 6, 8, 10 months, we have seen some real vocal support from other members of Congress. The top 6 are those who have been most engaged on a variety of levels. The next 6 are individuals who either have expressed an interest. Our organizations here in D.C. have had some very successful meetings with a number of these members. There are people who want to talk about the programs, want to promote the programs. But even our strongest champions are often unaware of what the grantees and the communities are accomplishing. And interesting to note that through the funding announcements for the community transformation grants, for example, there's actually a requirement to develop and distribute documents, information, backgrounders, one-pagers, infographics to the broader community, and to publish on the successes of those programs. Also, in general, the grantees are required to provide information on the successful initiatives that can be widely disseminated and published. And then 3, one that I was interested to, almost surprised to find in light of all the discussion in the last couple of months, that an actual requirement, at least in the initial funding announcement, to communicate at least quarterly with elected local, state, and federal officials on progress that's being made. So not only is it allowed, but it's promoted, it's required, it's expected, and I think we all have to do a better job of doing that. Tacoma appears to become one of my favorites to promote. 1, because they're doing great work. 2, that they have not been shy to share that work publicly, including with their policymakers. So they're doing all the same kinds of things in addressing health equity and supporting safe and active streets, expanding access to healthy food that other grantees are doing. The leadership team is a great example of the types of non-traditional partners that are involved in the community transformation grants. Sure, not a surprise to the YMCA, but the school district, the Franciscan Health System, the city, the county, the park system, the Boys and Girls Clubs, the Urban League. I mean, these are the kinds of individuals who, even if they're not receiving the funds directly, are those that have influence and the ability to communicate with their policymakers, and we need them to do that. Douglas County, one of my favorites, great graphic here, thanks to my colleague Tim Hughes, and it shows the diversity of their leadership team. This is exactly what these funds are meant to do. Meant to be health in all policies, to build partnerships with business, with communities, with faith-based groups. And if you're in Nebraska and you are engaging some of the largest employers, such as ConAgra, the University of Nebraska can certainly do no wrong in that state. Blue Cross Blue Shield, Catholic Charities, the Chamber of Commerce. I mean, that you're hitting on all cylinders here. And think about the political influence, and think about the doors that those groups will open in being able to discuss the program. So it'll be interesting to hear what my colleagues have to say on the messaging, but the messenger is important. This shows the kinds of messengers. And New Jersey as well. I'm kind of fascinated up in New Jersey a couple weeks ago, and just to look at this coalition that they put together. 178 professionals representing 113, over 100 agency organizations and state departments is amazing, and really is a model example of what we'd like to see. So let me stop there. Remind people that we have resources at Trust for America's Health. Get to them at healthyamericans.org, and just leave you with the general idea that great work is being done. We're trying to circulate as much of it as we can. Some of the other national groups, the National Association of County and City Health Officials, APHA, the Lung Association, or a number of the national partners that are doing some similar work and getting the news out there, because it would be a shame if all these funds were being invested in super effective programs, but that those who can have an effect on the future of those programs, if they were unaware, that would be kind of a sad thing. And so, really urging everyone to communicate with the media, with partner organizations, and really to expand the reach of the successful programs that are being funded by the Prevention Public Health Fund.
Thank you, Rich. Rich Hamburg with Trust for America's Health. And before we move to Laura, I did want to bring up poll 2 if we can. And so I'm also going to switch that so you can see on the screen. After listening to Rich talk about the background and what's happening with the Prevention Fund, the current landscape, the threats to the funding, but also importantly, what's necessary to do to demonstrate the partnerships that this funding is being used to do, I want to just ask the audience, and please, for those of you listening, on your screen right now, on the bottom right-hand side, there is a poll. Are you a current or past recipient of federal prevention funding? Please do click on the options, and you can actually, for some reasons, actually you can only do one. Some of you I know might get CTG and REACH funding, but please do click on the responses below and click submit. You only have a couple of minutes to do it. It's really important that we gather information from which of you are currently getting funding, and then if you have other funding from CDC or other federal prevention funding, please do put that into the Q&A, and we have a couple of people there. We have Sarah, who receives heart disease and stroke prevention funding, and Melissa, who receives CPPW funding. So that's really important. And just a reminder that the Q&A feature is on the right-hand side of the screen as well, so you can send in comments and questions. So thank you for that. We're now going to move to Laura Siegel, who is also with Trust for America's Health, and is going to talk about some of the national polling and the focus group work they've been doing along with Robert Wood Johnson Foundation. Laura, so it's over to you, and off you go.
Great. Thanks, Matthew, and thanks for having us on today. I'm going to go over some message and opinion research that we've been able to do over the past 10 years in partnership with the Robert Wood Johnson Foundation, and we've been really fortunate to have the ability to do this and do it over time, and it was a big help in helping us get the Prevention Fund passed in the first place. But as we all know, having strong messaging is one component, but then using it and being active and vocal as advocates is important. It's not going to turn around a political landscape in and of itself, but it's helpful to have as strong a message as we can. So what we've found over the past 10 years and why we've focused more on calling it the Prevention Fund and using the word prevention is we started with the field of public health as the starting point and found most people just really find that confusing. There's a lot of issues with people understanding preparedness issues versus chronic issues and so forth. And so parsing out prevention to focus much of the effort around has been a helpful way to approach it, and it's been consistently popular over time. We found that messages that stress the value of prevention, future in kids, and accountability are always rise to the top, and this has been consistent over the past 10 years. On prevention specifically, we found as a concept it's very popular. It's understood to mean improving health, that people like and get the value of prevention much more than having to prove it to policymakers or to folks in the academic community who are looking at specific studies. Just naturally people believe it improves the quality of life and will help with cost savings for healthcare. There is really a deeply ingrained belief across the board that personal responsibility needs to be part of any conversation about health, and it sometimes is in contrast to how people talk about public health or population health. But if you incorporate that into part of the messaging, it helps diffuse some of the pushback against prevention and public health being a nanny state approach or taking away choices, or really helps reduce resistance. And kind of a key mantra for that point is talking about healthier choices, making them easier choices, and stressing opportunities and creating equal opportunities for people. Again, messages that focus on kids and the future help. And localization, which is Rich was talking about, specific stories really help. And focusing on achievable goals and that we can actually turn this around and turn health problems around rather than that they are just so deeply ingrained that that is not possible. So giving people an aspirational message even after you've presented current health stats to say ways that we can help solve this through CTGs and other approaches really helps. The most recent set of opinion research we did was this past fall. With the Robert Wood Johnson Foundation, we did focus groups and a national survey. We do keep consistently finding here that the prevention is very popular. About 2/3 of Americans are in favor of investing more, and there are other key findings just without tying it to money that it goes into the 70% of people just being in favor of prevention as a concept. We tested this past fall the Prevention Fund specifically, and we did pit that against looking at if you support the Prevention Fund by name or just conceptually what the Prevention Fund does, and found that 70% favor it either way. So it's not, unlike it being a political football in Congress, it's as a concept just out across the country a popular idea. Again, just to illustrate that one of our biggest weaknesses is in this area of combating nanny state messaging, and that putting in the nod to personal responsibility does help diffuse that, but it really is a big hurdle messaging-wise for us to always remember. We have more specifics on the messages tested, and if you'd like that, please feel free to contact me or Rich. But just to show how strong some of these messages are, looking at messages about kids and the future and the value of prevention is 80%, close to 80%. So those are just extremely strong messages. That's really rare to see things pop that high. We were looking at different ways of talking about prevention as an economic issue, or particularly given when it's when we're in budget battles, that becomes the leading concern when talking to policymakers often. And return on investment concepts are the strongest when you're talking about the economy. We tested a whole range of things about economic competitiveness globally and job creation and so forth, and a lot of those fell pretty flat because they were just hard for people to understand how that connects. It's kind of 2 clicks away as an argument. We're just talking about the ROI. That falls into people just getting inherently the value of prevention. Just to summarize, some words that work that we found consistently do well: the phrase making healthy choices easier choices, talking about a healthier America and improving the health of all Americans rather than focusing on the disparities side of the equation, that the more you can talk about it helping the whole community, that all Americans benefit, and creating equal opportunity for everybody really helps get beyond some of that, the resistance people have when you're dealing with supporting disparities. Giving a nod to personal responsibility by saying we understand that these are personal decisions, but decisions are influenced by the world around us. Talking about the barriers and how to solve them. Talking about the future of this generation, but we can turn that around with an aspirational kind of closing. Just reiterating the value message of prevention can save money, has a real value as a cost-effective, common-sense way to help people stay healthy and improve their quality of life. A couple different ways of saying the same argument: return on investment. People like the idea of health care versus sick care. Talking about health starts where we live, learn, work, and play. Talking about health beyond the doctor's office, or combining and connecting your health care you receive at the doctor's office with ways to follow your doctor's advice beyond the doctor's office. Making that connection helps people understand what we're talking about often with the community programs and issues. That this idea, as Rich was saying, talking about the partnerships, tests really well, and it's also an effective strategy that we are bringing together all these different aspects of a community of transportation and education and so forth, and stressing that it takes these partnerships, and people like the idea of different groups working together, that no one can solve this kind of on their own, but talking about these effective strategic partnerships. And using the specific examples in real results is our strongest argument at the moment, and that's why we've all been so focused on collecting your stories and finding ways to tell them, and have seen the power of walking into members of Congress's offices with specific stories, coming in along with partners that are working with the health departments, such as with businesses or schools, and how much stronger an argument that makes it, how it's concrete and real to people. And so we at TIFA have been putting together a story bank, and would encourage anybody listening who would like to help provide stories, and we can even help in many cases write them up or edit them and so forth, to continue to do that, and send us examples that you do have, that those have enormous power and resonance right now. So I think that's the top-level summary I have, and would be happy to answer questions as we go further on.
Thank you, Laura. That was a really fantastic summary, and I think it's really critical as our audience are listening. I was just looking at the poll results, and about 30 or so of the participants, 35, 36, are receiving some sort of federal funding, whether it's CTG or other federal dollars. About 35% aren't, and obviously interested advocates and or partners supporting this work. And so I think it's really valuable to hear, based on your findings, exactly what works, what's having an impact. And I think we're going to talk later as we hear from Anne and then Rob, and then we'll loop together as a panel together to have a discussion and hopefully hear questions and Q&A from our audience about exactly how we can be most impactful in reaching out to decision makers and others. I do have a question for the text, for the Q&A chat, which is to ask the audience, those of of you listening today, those who are both funded and unfunded, what, if anything, is currently limiting your ability to tell the story of prevention in your community, to talk about the success? What is currently limiting you, whether that's reaching out to the media and telling the story with local press, or if that's reaching out to local elected officials or your federal officials? What, if anything, is currently limiting your ability to do that? So please do use the Q&A feature and tell us, the audience, what it is, because it will help us to then take the findings of the polling information that Laura is describing and be able to describe that to you as well. So we're now going to move to Ann Whitten. Ann Whitten, again, with Public Health Institute. She's the Director of Communications. And before, again, we'll also hear later from Rob Waters with Prevention Institute. So Ann Whitten, it's over to you.
Thank you so much, Matthew, and thank you, Rich and Laura, for setting the stage of how important this conversation is and how we can really affect both the public perception and also our decision makers' perceptions of what prevention is doing in our communities. I want to talk a little bit about the power of data in helping to illustrate our stories. And I want to tell you a little bit about what we can do with data, but I also want to say a few things that we can't. As anyone who's ever gotten in an argument with their relative at a Thanksgiving dinner can tell you, facts don't always trump emotion. So just having numbers by themselves is not always going to change someone's mind. However, when paired with a compelling argument, when paired with some of the phrasing and the words that Laura shared, data can really help illustrate what's happening on the ground in communities. It can make the case both for media and for our legislators. It can also create media hooks, giving you the opportunity to get your story into the news, and it can help focus our efforts in our communities themselves. So I'm going to today, as an example of how data can really have some power and add an extra push behind our messaging, I'm going to share results from California's field poll that was taken in rural communities here as part of our CTG work in California at the Public Health Institute's California for Health. I'm going to explain how we use that as a media hook and illustrate how data was used to make a broader case for the popularity of prevention. And I'm also going to share some ideas of how you can find and use data in your own work, in your communities, if you don't have your own field poll data at hand. So quickly, the California for Health initiative is PHI's initiative around community transformation grants in California. We're working specifically in 12 communities, 12 rural communities in California, and those counties were surveyed as part of this field poll, and they are some of our most isolated communities in California and our smallest communities in California. And this is conducted through the Field Research Corporation, and it's supposed to be the first to explore health-related voter opinion exclusively in California's rural communities. As you can see, the poll was conducted last August, and the poll results were released late this winter in January. So quickly, I just want to share a little bit of the findings of the California field poll. They underscore what Rich and Laura were sharing that's happening on a national level. And I also, just for folks who aren't familiar with California in terms of what our politics look like, I also want to share that our respondents for this survey were about 42% Democrat, 34% Republican, and 24% no party preference. So this is it's a good window in terms of what folks from different parties and different ideological backgrounds really believe. So as you can see from this slide, 94% of registered voters who were surveyed said that obesity is a serious problem for the nation, and 84% believe it's a serious problem for their communities. This is not really a surprise. This is something that we've seen in many of our national and regional polls. And again, the question, how much does the neighborhood where a person lives matter when it comes to avoiding the health risks associated with being overweight or obese? People said place matters. 68% of our respondents believe that the neighborhood where a person lives matters. We were interested in finding out what people saw as the role for our different community groups and organizations in helping with obesity prevention. And I think, again, this is a great example of how data can really dispel some of the myths that are out there that people believe and are perpetuating about whether or not people really want to see interventions at different levels. You can see that it's probably not a surprise doctors and nurses are seen as having a major role, but as you look down the chart, you can see that people see that food retailers, food and beverage companies, and federal, state, and local government all have a role to play in obesity prevention. And I think that this is an important statistic that we were using to communicate to legislators that, yes, people do see that there is a role, regardless of how the nanny state framing is put forward, that there is a role for these different groups in helping to prevent obesity. And I think this is an important one for us to share. And then, again, dovetailing with what Laura and Rich were talking about, do public investments aimed at keeping people healthy, like building parks and promoting neighborhood safety, pay for themselves in the long run by preventing disease and reducing health care costs? So 78% of voters agreed that public investments pay for themselves in the long run. And then the last slide that I'm going to share with you from the results, looks like it got stuck in here again. So I'm going to skip this one. And I'm going to talk a little bit about how we used this prevention polling data. When it was released in January, we ended up with about probably 10 to 15 regional newspaper stories within the state of California, as well as some larger ones in the San Francisco Chronicle. There were some media, radio interviews, and overall, for about a week or so, we were able to get the story into the news. And really, what's important about this is that obviously the work that all of you are doing, for instance, in your communities is ongoing, but that there are often opportunities that arise where we can use them to kind of lift up our work. And this was a perfect example. So what we were able to do is to make the story around the field poll results and then use that as a hook to talk about the work that was actually happening in communities. So it became the opportunity to tell our stories more broadly, and those opportunities do arise often. I'm going to give some more examples of how you can maximize those in a few minutes. But so here, this is from Ukiah, which is one of our smaller communities. And you can see the story was about the field poll, but you can also see how the quotes, again, were used to lift up exactly some of the messaging that Laura was talking about. And so you can see when healthier options are readily available, people can make healthier choices for themselves and their families. And here's another example. And this was in Tuolumne County, and it's from Dr. Stolp, who is heading our California for Health work there. He said, we're working closely with local schools, organizations, businesses, and other leaders to move closer to our goal of creating a healthier community. Sorry that got overlapped there. But again, he's emphasizing the partnerships piece that Laura mentioned earlier. And this was in the San Francisco Chronicle. One of the poll results was looking at soda tax support. And again, showing what Laura's research also showed, it was interesting that the finding was that people would favor a soda tax if its proceeds were devoted to improving school nutrition programs. And the kind of strategies that were emphasized in the quote were strategies that are linked to kids and children specifically, giving more money to schools for physical education programs, keeping playgrounds and athletic fields open for more hours. And then finally, just to show that they are consistent with their messaging approach, here's a quote from Trust for America's Health. And this was in regards to a different quote, a different poll from the Associated Press. And Jeff Levy, you can see his quote here. He says, we need to create environments where the healthy choice becomes the easy choice, where it's possible for people to bear that responsibility. So what you're seeing here is how data can be used to create a media message that reinforces the kind of framing that we want to hear about prevention. And it doesn't become the message in and of itself, the numbers, but what it does is it becomes an important component of creating a persuasive message. You can also use polling data with your legislators. Again, going back to what Rich said, you want to educate them, and this is certainly within the allowable strategies as a CTG community. And what I want to show you is how we used our own data platform to illustrate what both was happening in communities in terms of data, and then how the Prevention Fund's community transformation grants can be addressing those, and also how public opinion was in support of those initiatives. So what we did is we just pulled up some data that showed in our 12 communities what the obesity rates were there. And this is a slide you can see here. And then again, pulling from the polling data, we were able to show how people graded the efforts currently being made in their community to reduce obesity. You can see that the majority of people, 78%, rated their community's efforts at a C, D, or an F level. And we pulled up some of our public investment questions and rated them by party. So again, it shows that there really is this broad and, regardless of party affiliation, support for these kinds of initiatives. And we thought that was something that was really important for legislators to see. And what we were able to do, I'm sorry, this is a little bit of a small slide. I had trouble fitting it all in. But we were actually able to pull up the same data by legislative district so that we could show our legislators directly where they lived, how people felt about prevention, and what the issues were that it would be addressing, the work in the communities. So both showing how serious people thought obesity was as an issue and what the obesity rates actually were. So this is an example of how you can use it to just really illustrate on the ground why it's important to your local representative that they support prevention work. Now, I recognize that not everyone here has access to field poll data specifically in their community, but there are other platforms out there where you can access some of this information. And I wanted to put in a plug for the Community Health Needs Assessment website. You can see the web address at the bottom. It's chna.org. And you can get all kinds of reporting tools. You can get custom maps. You can show what some of the access to junk food is in your community, or what whether folks have access to parks, things like that can help you illustrate what's happening in your community. As an example, I just pulled up a quick report from where I grew up in Pinellas County, Florida, which is also a community transformation grant community. And you can see here that it just gives you some statistics on how many people have access to or don't have access to food, for instance, liquor store access, air quality, all those kinds of statistics that you can use to illustrate and to support your messaging and framing arguments. Other opportunities for polling data, I'm sharing just 2 Gallup polls that were released in the last year. One was from December and one was from July of 2012 that give exactly the same kind of stats that you saw in our California field poll result. You can see people are concerned about obesity. These kinds of stories make great media hooks. If you see that a Gallup poll is being released, this is a wonderful opportunity for you to contact your local media and say, yes, people are seeing that obesity is really a problem, and here's what we're doing right here in our neighborhood and our community to address it. And this could be a perfect example, a perfect opportunity to get your work into the news. And here's another example. This is the one that Trust for America's Health had commented on earlier, but the Associated Press did another poll recently about obesity in the United States. And again, these are wonderful opportunities for you to kind of to latch on to a story that's already in the news and be able to tell yours as well. So what I think we're going to segue into Rob talking a little bit more about how to tell your story. And again, I just want to point out that this is just one element that's an important piece, and then you really want to kind of tag it to the messages that are out there. These are really important at illustrating to our legislators that as Rich said, that our work is actually really having an impact. And once you tie them up with the messaging and framing, you will have a very strong story that can be in multiple settings really convincing. So here's some ways that you can stay connected to Public Health Institute, and I'm going to pass it over to Rob to finish things out.
Thank you, Anne. And Rob, over to you. But while you're just getting ready and we're bringing up your slides, I do want to just remind the audience again to send in your comments, questions, feedback using the Q&A feature, which is on the right-hand side of your screen. There's some great comments coming in, and we're going to address all of those right after Rob. We're going to open up the discussion for all the panel. And so please do send in your comments and questions. And actually, Rob, before you actually speak, let's bring up poll 3 if we can. Really quick if we can on the screen. And poll 3 is, have there been stories in the local press about your prevention work? So based on what Anne was describing and then what Rob's going to discuss, it'd be really good to get an idea. Have there been stories in the local press about your prevention work? And just answer yes or no and provide examples in the Q&A if you can, which is great. Okay, Rob, over to you.
Great. Thanks very much, Matthew, and thanks to all the groups for pulling this together. As Matthew mentioned, my background is as a health journalist. So I thought I would use a few minutes today to share a few tips about how to tell the story of prevention and how to get it into your local media and publications. And let me get the slides advancing. So telling your prevention story, there are many opportunities, different ways that you can reach local media and try to tell the story. You can identify reporters and publications that may want to write about your program by following the local media and getting to know who the reporters are, who the talk show hosts are on local public radio. You can learn your newspaper's policy on op-eds and guest columns. In addition to regular op-eds, a lot of newspapers have Saturday or Sunday commentary or opinion sections. Some have health sections, and these often include offerings penned by local people, especially those folks who are seen as having expertise in the area. Some local radio stations will run short audio commentaries on interesting topics. You can also get to know local blogs. Many cities and regions have blogs that might write about your program or that might post something submitted by a community member. You can look for people who blog nationally and write about health and policy topics. One thing that we can't emphasize enough is that we know that people are worried about being seen as lobbying or engaging in advocacy. Sharing your story with the local media is not only okay, it's encouraged and essential. The next three slides are examples of a series that I did on prevention funding and the use of prevention funds by communities in my blog at Forbes.com. And I'm just showing you these as a way of telling a local story. In each case, I told a local story, and there are certain elements of telling that story that I wanted to talk about a little bit here. First of all, any good story needs to start by stating the problem and using local data. As Laura mentioned earlier, specific examples and real results. So in the series that I just showed, I presented some data how, about 1 in 10 people in Tennessee have diabetes, how fresh fruits and vegetables are difficult to find in communities in rural Wisconsin, about how for the Makah Indians in Washington State, the shift to a modern lifestyle has led to increases in diabetes and other chronic disease. So get this data, present it for you can use national data, but back it up with the best local data that you can. And then present your program, your community prevention effort, your CTG-funded program or your local health initiative as presenting a solution, as addressing this problem and promoting real change. So the Nashville, in the piece that I wrote about Nashville, I talked about how their initiative has boosted rates of breastfeeding in hospitals, how it has supported bike programs and bike share programs and bike trails and hiking trails, how it's helping bring produce to food deserts through a program called the Nashville Mobile Market. The heart of a good story is in these kinds of specifics. How many hospitals are taking part in efforts to boost levels of breastfeeding? How do these bike programs actually work? And, of course, the biggest thing is what's the impact? What difference are these programs making? And then finally, you know, an important element of a prevention story or of any good story is to find a person who can tell the story. And this is I can't overemphasize this. Whether you write about this person yourself, or you sort of debrief the person, interview the person, and help prepare them for local media interviews, having a human story about someone who has benefited from this kind of work is really essential, and can really help make a story both see the light of day and be effective and compelling. Media people always want to show the human impact of an issue or story. So, you know, in here I'm talking about people who can tell the story. The program participant, person who has benefited, is always sort of that's the best hook in many cases. Program line staff people who work closely with participants would be a second choice. Healthcare providers who can say how a program is improving health is also, you know, can also be good. You can't always find the person who the program participant, but you can find people who work with them, and anyone who can really talk about the personal human impact, not on populations, but on individuals. So we want to frame it with a population, kind of a population overview, but then tell the story, if you can, of one individual and how they have been helped by this program. Finally, at Prevention Institute, you know, we're really interested in sharing these stories. So you can contact us and tell us your story, and we can help you to write about your community prevention efforts. We can write about it ourselves in my Forbes blog or in other blogs that we write. We can help you pitch and write your own story if you want to submit something to your local newspaper or other publications. We can offer suggestions on your approach. My email address and the email address of my colleague Lily Swartz is on the screen now. Our phone number is there, so please don't hesitate to call us or contact us. If you have a good prevention story, we'd like to help you tell it. It can be really effective when it's done well. So we're here to help.
Thank you, Rob. That was some really great advice and recommendations for people, and I'm going to leave your information up for a moment just as we open up now the panel. And I'd like to bring back in Rich, Laura, and Anne. We've got about 30 minutes left before the end of the forum, and this really allows us time to get in depth in the discussion today. And I also know we have on the call today, we have Sue Polis and Sana Shimini, Sue with Trust for America's Health and Sana with Prevention Institute, who also may be able to provide their comments and perspective as well as we really unpick what we've heard from our panelists, both in terms of what the perception about prevention, the words that make a difference, the words that work and have an impact with people in communities, and then as a result will also have an impact with decision makers. How we can be impactful in reaching out to the media and reaching out to decision makers to showcase the success of prevention. We've had some really good comments that have come in as well, so I'm scrolling through the Q&A. I'm going to just bring up some of those and mention them to help weave in this conversation as well. Just a reminder to send in your comments and feedback. Fortunately, we can't open up the phone lines, but we do have an opportunity for you to send in your comments using the Q&A feature. Before I get into this, because I know there's been a couple of questions, Rich, for you. One came actually from Sarah Cawthon. She wanted to know about the funding amounts for 2014. So before we get back into messaging, Rich Hamburg, I'm wondering if you could just address that question for those who are wondering what is going to be the future for the Prevention Fund and for the CTG program. When are we expecting to see the FY 2014 funding allocations?
In the textbooks by October 1st, 2013. In reality, less than 50-50 chance of seeing those numbers before the end of the year. This year we didn't see them until literally the spring. So if I would say sometime early next year.
Okay, thanks, Rich. And we understand, of course, right now, it's, even though they say it's, been getting back to regular order with the appropriations, it's very difficult to see how we're going to be able to reconcile the House and the Senate differences in what they've been proposing, and so there's going to be an uphill push in being able to bring those two.
And just for example, in order to even have a hope of moving other bills to free up some dollars, the cuts were even more severe to the Labor, Health, and Human Services budget. So, if you put a almost 19% cut on the table, that's going to make that pretty unlikely. So you have two things that need to happen. One, finalization of the 2014 discretionary dollars, and then also finalization of the prevention fund allocations, which now for the fourth consecutive years have been left in the hands of the Department of Health and Human Services. We're hoping at some point in this process that Congress does dictate how those dollars are going to be spent, but that has not happened yet.
Okay, so now opening up for all the panelists, a couple of key questions. One comment came in from Lucy about the fact that many state government communication strategies are focused on healthcare delivery rather than prevention. And so as people are developing messages, I'm wondering what advice we might have for our audience, those who are advocating for prevention in their communities, how they can tie, first of all, you've got a challenge within your own organization or infrastructure to be able to make the case to actually get the approval from your health department or from your community organization when people are so rightly concerned about increasing access to health care, or how they're concerned about implementation about the Affordable Care Act or addressing the underserved. How can we make sure that we're also underscoring the case for prevention? Also, at the same time, where we saw polling came out that over half of Americans are still, quote, feel negatively about Obamacare. So starting with, I'm actually going to bring in, we'll start with Laura, then Anne, then Rob, and Rich, you're welcome to weigh in as well. What are recommendations for how we can tie the prevention messaging when there's a lot of focus and attention on health care delivery?
I think one thing we've seen in the past few years is an uptick in people understanding community prevention or community health and what that could mean in a way that's more similar to how we mean it. And one thing that we found is effective in tying the issues together is to talk about health inside and outside the doctor's office, and being able to carry out your doctor's advice in your day-to-day life. So, for instance, talking about the example of if you are pre-diabetic and your doctor tells you to, eat better and get more exercise, but you live in an area without the opportunity to have access to safe parks or to access programs and so forth, you're not going to be able to carry out that advice. So in some ways, I know that there's a resistance in the field of public health often to personalizing the stories, and also wanting to make the distinction between community programs and the doctor's office. But actually, the more you tie them together, people like that and get that, and even a lot of the doctors themselves are starting to use that message or look for resources to refer their patients to and so forth. So talking about, the health care system and all of these changes can never work unless we also are giving people the support to carry out their doctor's advice in their day-to-day life. Has been one way we've done it.
Thank you. Anne and Rob?
Sure. So I agree with Laura. I mean, the idea is that prevention is something that goes hand in hand with what happens in the doctor's office, not that one is supposed to supplant the other. And I think that people do really understand that. I also think talking about how prevention can take some of the burden off of healthcare is important. I think that that's something that people really understand and feel very emotional about is, spiraling healthcare costs and concern about scarcity. And so being able to frame it in a way that prevention is also something that having more people be well is going to benefit the healthcare system as well can resonate. And then Laura mentioned in her presentation talking about ROI as well, and I think that that's another piece that really that we're saving money down the road in terms of our healthcare expenses by investing in prevention now.
Now, I would like to mention we have some examples in our recent Healthier America 2013 report, and I know a lot of you all have examples on the ground of that return on investment, and that prevention can help people stay out of the doctor's office too, and that brings down costs. So, there are some great examples that people can cite. For instance, we have some profiles of an Akron community care community where working as a community with all the businesses and the health departments and the hospitals together, they've been able to cut down emergency room readmittance. They've looked at, all of those things that are the push-button issues for cost containment in healthcare that prevention can help bring down those costs. So giving some of those specific examples to back that up is also really helpful.
Thank you. And Rob, perspective on that, and we can move to a next
Sure.
question.
No, well, just briefly, I think there are probably two barriers. One is that, internal to health departments and health coalitions, there may be, resistance on the part of leadership to really, people may distrust the media or be reluctant to have staff go to the media, or be reluctant to be being seen as advocating in some contexts. And I think, you just have to keep making the case that without telling the story, it's going to be very hard to maintain these programs. So that it's literally in every program's interest, absolutely in every program's interest, to be telling these stories and to be putting out the word. People are reluctant. I know that there's always reluctance to individualizing stories, as I was sort of talking about earlier, the power of an individual story. Despite that reluctance, people, if you can find ways to do that, find people who can help tell the story, I think that can be one of the most powerful vehicles for putting out the word. And finally, just to reiterate the polling data, people really get it that prevention is tied into healthcare. People really understand how important prevention is. I think it was 83% in the data that Laura shared earlier. So play on that and use that.
And I think one other thing with the individualizing the stories, I know with people in public health that we aren't necessarily looking always for stories that are personal about one person's effort to control their own diabetes, for instance. But for instance, maybe it's somebody who, as an individual, has found, oh, look, in my entire community, this was an obstacle that stopped me from being able to exercise, and I led this initiative, or finding the examples of individuals who led a community initiative to solve a problem, to reduce a barrier, is one way that I've seen some groups do that pretty effectively, where you're targeting an individual who's been a community leader, who's used their individual issue to solve a larger problem.
And just briefly, to give one more example, you don't have to be looking for someone who's going to tell some, very intimate, painful, or private information. In one of the pieces that I did about the CTG funding to the Makah Indian Reservation, I simply found a woman who was, an 80-something-year-old woman who is now taking part in the walking club, and so she went walking, several times a week with other people as a result of the CTG funding to the tribe, and that's enough, I think, of a vehicle to show how someone is really benefiting from the program.
And I also wanted. Oh, sorry.
Go ahead. Sorry, Laura. Keep going. This is great.
I wanted to also point out this summer, coming soon. I don't have the exact date. TIFA and the Robert Wood Johnson Foundation will be putting out our annual F as in fat obesity prevention report, and that's similar to putting out, when people put out polls, that can sometimes be a good hook for health departments and other groups to look as a hook to personalize it, to localize it to their community. And for instance, a lot of the health departments actually get proactively called by their media, and so it's kind of a way where you're responding and not just having to convince your officials that you're being proactive. It's part of that conversation that's already out there to give good examples of what is going on in the community to deal with the obesity epidemic, for instance. Another yearly hook or another hook that people can play off of all year is the county health rankings that the Robert Wood Johnson Foundation puts out, and responding to that or putting out some sort of media that's, or press statements or stories that connect to those. So sometimes those can help provide some hooks as well.
I wondered if really quickly we could address the value of using other messengers, and particularly employers who are the ones in many cases who are bearing the burden of the healthcare costs. Having employers be the message, so it's not coming from the health department, but coming from others in the community, both small businesses, but also the larger employers, and what recommendations we could have to, so our partners on the phone today or listening on the web forum can use them as spokespeople. Ann Whidden, I'll come to you first, and then others can weigh in as well.
Well, I think folks from the community can be really persuasive in ways that often people who are more entrenched in public health work can't be. Sometimes it's because as public health workers, we might have some restrictions in terms of what we can or what we feel comfortable in saying, although I always encourage people to stretch a little bit around that. But also that community members, can just resonate in a different way, and they can also show the public support for prevention efforts in a different way. So for instance, if a parent is talking about how community transformation grant work in her community has put healthier foods on her child's school lunch plate, or made it easier for her child to walk to school or ride their bike to school in the morning, those kinds of stories from people who are really affected by it just resonate in a different way, both with media and with decision makers. They don't seem as like they're coming from someone who maybe has more of a stake in it. And I think that that's important, and it's, and it's an honest representation of what community transformation grant work is doing, which is really benefiting folks from the community in ways that make a difference for a long time. And I also think you mentioned the business community. Again, I think that those are people who have a different stake in having a healthier community, whether it's because they're getting a healthier workforce, that they're pulling from a healthier community, and or that things like investments in their community, like better public transportation or bike paths or things like that, are also bringing them more business in their local shop. So those are people that they can just speak to a different impact of prevention work, and again, it can be more persuasive to people. So it's really important where folks have their leadership teams, where they can tap people ahead of time, figure out or collect narrative data as you're moving forward. Collect that information now. Get a quote from a parent at a school or from your local business leader, so that when you're ready, you have that data and you can that quote, and you can drop it into a story or pull that person forward to be a spokesperson for your efforts.
And I would say that, on the business side, that there's also a secondary impact if you can get business leaders, if you can help them to, if they're a member of your coalition, if you can help them to author a guest column or an op-ed or even submit a letter to the editor, that has the secondary impact of making its way to legislators. And, business leaders obviously have a certain impact on legislators and policymakers, and that can be a really important impact.
We've also
so I wanted to talk about just because we've only got 15 minutes left, and I want to talk about the risk of fear being a great immobilizer. And we've talked about this before on these web forums, but I think it's important to reiterate that so much concern from those in the public health community about what they can't do because of perceived restrictions on lobbying. But of course, when you're a funded grantee, there's so much that it's really actually required of you to do, to say this is what we're spending these dollars on. There's a need to be accountable to the public and to the funder, the federal agency, about the fact that these dollars are being used appropriately and they're having an impact in the community. And I want to come to Rich Hamburg, because I know, Rich, you have responded to this on the Q&A feature, and I want you to just, if you can, reiterate this, because you also raised it in your slides, that there actually are requirements that are entirely appropriate and allowable for people to be reaching out and showcasing what they're doing. I wondered if you could just go over that one more time, because it's really important to hit home with the audience.
Yeah, absolutely. I think that let me just get that in front of me, is certainly to and not only can do, but required to do, to develop some simple ways to disseminate the information. So success stories, background information, things that can be posted on the web for easy access, and then written into the initial funding announcement was to communicate. This is, I quote, "at least quarterly with elected local, state, and federal representatives to update them on progress being made in their district for prevention public health resources." That's progress being made. That's not to advocate for the programs. It's just to report. So there is no problem with any federal grantee making those kinds of reports. Now, in line with what was discussed earlier, that can be done through the grantee, or it can be done by proxy. And if you look at the slide that I put up there on Nebraska as an example, I'm going to think that a U.S. Senator from Nebraska is going to listen to the messenger. If the messenger is from the University of Nebraska, is from ConAgra Foods, is from the Omaha Chamber of Commerce, Blue Cross Blue Shield. I mean, these are people that have some access. And when it's coming from them, I think it'll have some greater resonance. So you have these two broad categories that go with at least the community transformation grants. These leadership committees that are 10, 15, 20, 30, 40 deep, representing a dozen or more different sectors, and then you have the sub-grantees, and I think that really it may not resonate as much with a policymaker if the funds are going, no offense to going through the states or through the large counties, which is great. I think they understand it, but I think it resonates even more when you can say, hey, these resources have made it through all the way to these local players, and funds went to the local community college and went through the mayor's office and to the YMCA, and I think that just heightens the case that's made. But you need simple information, being communicated in the ways that my colleagues talked about, on this webinar, but people shouldn't be shy to do it, because if my problem through this whole process has been that those who don't appreciate the power of these strategies and policy change, are going to sit back and smile, if they think that that idle threats and false threats have stopped individuals from making these kinds of communications. So I think your role, as a grantee or as a partner, is not to let that happen, and to freely communicate the good work that's being done through these programs.
Could you also just speak to the fact of the administration support for prevention? We had a question come in from Gary about, in addition to legislators communicating with leadership at CDC or HHS or other agencies or even the White House, and obviously, the shift that happened earlier in the year was to support the health exchanges. So can you speak to that, Rich?
So there's two things you have to keep in mind here. One major thing is that there are competing priorities, and there's always a higher priority, no matter how high we think our priorities are. So, moves like those that were made to redirect the funds for other priorities, it was done early in the administration after passage of the Affordable Care Act to allocate a certain percentage of the fund to healthcare workforce, and this time for implementation of the exchanges. So I think our role is to recognize that those are important priorities as well, but that that the work that you're all doing, the programs and policies that are being put into place, we're meant to be part of the complement of policies that went into place with the Affordable Care Act, and we've seen that those that are confronted with these competing priorities may, in fact, at some point choose a priority that's not ours. And if a tree falls and nobody hears it, we're in big trouble. So it is there is nothing wrong with communicating to the Department of Health and Human Services, to the Centers for Disease Control and Prevention, to the President of the United States, that what your priorities are, and to think twice about using these funds for other priorities. There are other places to seek resources, and so we just need to that's one of the reasons why we got to talk about messaging and making a stronger case, so that next time funds are needed for another priority, they don't come out of the hide of public health and wellness and prevention.
So I want to ask the audience, what is one thing that can help you to showcase the success of your program in your community, or showcase the importance of prevention funding for your neighborhood, your community, your city, your county? What would that be? What tool or resource would be important? Use the Q&A feature to send those comments in, whether that be sample letters, it could be a template for a case study, it could be access to the type of data information or information how you could go about doing polling that you heard about earlier. Just please send in your comments so we can respond to that. And I want to come to the panel. For Laura, Anne, Rich, and Rob, tell us what resources are available currently in your respective organizations or elsewhere. We know APHA has resources. Could you just describe some of the resources that are there to help with this messaging effort? Just jump in, first come, first serve. I'm going to call on someone then. Why don't we hear from Rob first? What are the resources that Prevention Institute has available?
Hi. Well, we're absolutely available to help you craft your story. If people contact us, we can sort of do a little interview with you and help you outline your story. We can use your story in our own. If it's a good story, we can use your story in our own communications efforts in our blogs. But more importantly, perhaps we can help you with some advice to craft and refine and submit your story.
This is Rich. We at TIFA, we're an open book, so we're regularly posting backgrounders, talking points, the stories that we're receiving, templates for submitting stories, and we have our own story bank that's getting pretty long at this point, and we also have this huge compendium of stories, backgrounders, materials, videos. I mean, there are great YouTube videos that are being put out there. So, multimedia approach is all welcomed, and we have at healthyamericans.org, we have a page, specifically in health reform that has messaging, talking points, one-pager stories, all of that. Feel free to use it. And for those of you who know as well, if you've got good information that you put your hands on, we're happy to share it with the broader community through our Health Reform Digest, through our Twitter account, et cetera.
And at Public Health Institute, we've also been focusing on sharing a lot of the California stories, but you're welcome to browse our website at Public Health Institute and see some of the stories that we've shared and the messaging that we've used in our press releases. We also have a data platform that we've been using to integrate, as I said, some of the data into stories and messaging, and if people are interested in more information about that and how they might use that in their work, they can also follow up with us.
I heard Laura. Go ahead, Laura.
We're also run, as I mentioned, the F as in Fat report that we'll be putting out soon, going to be putting together some sample letters to the editor and op-eds and things that people can use to tie in and place some information about your local efforts within that. And as Rich said, we also do have, it's not unlimited, but some ability if you have great stories and you're looking for help to tell them. We've done a lot of stories where we interview or set up time for a brief conversation with officials and put together a story that we would run by you before we post on our website to help with that communication as well.
Thank you. That's great. So I now want to bring up poll 4 if we can, and this is our last poll today. I want to just make sure we have an opportunity for our audience to respond to this. What action are you likely to take as a result of this web forum? Please choose all that apply. The responses are: pitch a story to local reporters, write a column or op-ed about your experience, speak to your legislators about the value of prevention in your community, identify local people who can speak about the value of prevention, and of course, there may be other things that you're willing to do, so please describe any others you might be willing to do in the Q&A section as well. Or if you're not comfortable, none of the above. We want people to be honest in their response, and if there are things you feel like you can't take action, please respond to that. It's just more important for us that you could please respond so we can really make the most use about your participation and understand exactly what you're willing to do. So you've got a few more seconds to respond to that, so we want to make sure that we're being responsive. So I'll give you a couple of seconds. Great. Okay, just a reminder that's polling features on the right-hand side of your screen. And a last chance for any comments or questions on the Q&A feature. We're coming to the last 5 minutes. And what I want to do is just remind you all about how you can continue to participate in going to the Dialogue for Health website. That's the dialogue, the number 4, health.com. And also the PHI website, phi.org, as well as to the websites for Trust for America's Health, Prevention Institute, where you can find out more information as well. I want to thank our presenters today. And what I want to do is take a moment for each of them to give some closing remarks about the one thing that's going to be most important as we look ahead to the remainder of the spring and into the summer, about how we can do everything we can to connect prevention to the people, to recognize the importance of messaging and sharing the successes of what's going on in communities, so we can connect the Prevention Fund to those legislators who will be making those votes and potentially cutting the funding. I want to hear from Rich Hamburg, Laura Siegel, Ann Whidden, and Rob Waters, our panelists today. Some closing thoughts from each of you as we round this up today, starting with Rich.
I think that I really appreciate everyone's commitment to these issues. The Prevention Fund has been the kind of the linchpin for a lot of this, but we need to be vigilant in in really making the case and figuring out how to best make the case for the programs and policies that we support, because however you slice it, there are going to be more limited resources available in the foreseeable future. So we need to make the case about the return on investment where we can. We need to do a better job of, we haven't talked about metrics much, but in the messaging is good, but we need to show results. And I think that's critically important. So the right messages, the right results, and I think a realization that we have to show how we can be potentially more make more progress and reach our goals even with more limited resources in the foreseeable future. So consolidation of resources and how to be most effective is important to communicate.
Thank you, Rich. Laura.
I think the issue that we keep finding is that prevention is popular, and it continues to be popular, and it's across the political spectrum. But of course, our issues are tied into a dynamic that is about funding and as Rich said, competing priorities and so forth. And it's increasingly important to not be shy about talking about your stories, and we know that there's limited time and resources people have to do that, and there are groups like ours and the Prevention Institute and others that are happy to try to help with that, but those are our best vehicles right now for gaining traction to keep these moving forward.
Ann Whidden?
Sure. Share your stories, do it often, find the right messages and the right messengers. I also think it's really great when people can think about their work not happening in isolation, and rather than just emphasizing one strategy that's happening in their community, to think about the multiple strategies and to communicate those. And also to connect the work that's happening locally to work that's happening across the country. This is really much more than local efforts. It's a nationwide movement that's happening, and thinking about how you can really tell that broader story of transformation, and in terms of, you know, sick care to well care across the country, when you can do that, is also very powerful. But mostly tell your story.
Thank you, Anne. And Rob Walters.
Yeah, I would just say remember that what we've gained, the fact that we actually have something called the Prevention and Public Health Fund, and that it gives out money, and that we also stand to lose that if we're not effective in continuing to advocate for it. Tell your story and get in touch with Prevention Institute, and we'll help you do it.
And I want to thank all of our panelists today for their great presentations and remarks, and really underscoring the urgency of the concern, but also the fact that there are concrete messages and steps that we can take to demonstrate the success of the work that's happening in communities, that we're all empowered and we're all able to take action. In some cases, different types of action depending on the organization, but we're able to do it, and importantly, we're able to reach out both to the media but also to elected officials. I want to thank Rich Hamburg and Laura Siegel with Trust for America's Health, and Whidden with Public Health Institute, and Rob Walters with Prevention Institute. I really acknowledge them for participating today, and thank you for your ongoing support. I also want to thank our co-sponsors, again, PHI, Prevention Institute, and Trust for America's Health. Trust for America's Health, I apologize there, for your sponsorship for today's forum. I want to thank the Dialogue for Health staff for their support and their help in putting this all together and keeping us running. That's Star Tiffany and Lotta Chan. Thank you both. And I want to just remind you that today was Connecting Prevention to the People, Voter Attitudes, Prevention Messaging, and Where the Prevention Fund Stands. Thank you very much for participating today. We'll see you next time on Dialogue for Health. And don't forget to take action to support the Public Health and Prevention Fund. Thank you.